Amanda Claire Brady was my middle daughter. Her older sister, Hillary, and she has a younger sister, Abby. Amanda came into this world a little earlier than we expected. After a long snowstorm in Nebraska, we went about a week without power. But she was healthy, and we were all very happy. Hillary was quite happy, although she loved to cover her sister with stickers at the time when she came home. She came into this world a little earlier than we expected, but she left this world much earlier than we ever thought imaginable. Amanda was about 10 months old when she had her first seizure in 1998. Like many parents, we really had no idea what had happened. She was asleep in her crib, and we heard something happen in the other room. My husband and I, Mark, and I went in to check on her, and she just wasn't acting like herself. She was kind of awake, kind of asleep, and we could tell that she had aspirated in her crib. We didn't really know what was going on. She was very lethargic, so we decided we needed to take her to the emergency room that night. That night, the doctors diagnosed the event as a febrile seizure. They told us to give her acetaminophen and just take her home and watch her. It was most likely a febrile seizure, and they aren't uncommon, but she probably wouldn't have another one. I apologize. Amanda had another seizure a few weeks later, and we were back. And again, they were saying febrile seizures don't usually recur, but it seems like she's had another febrile seizure. They talked about putting her on medication at that time. She was barely a year old, and I was not convinced that we needed to do that at the time. I really didn't know anything about it. I just knew this was my baby, and I don't want to put her on medication. What's happening? Why do they just want to do this? So we went home that night without medication, and life was pretty normal for a few months. We didn't have any more incidents until we did. The third time Amanda had a seizure, the doctors at the ER insisted that I needed to get her on medication. And they also sent us home with a prescription for phenobarbital and also an appointment with a neurologist, a pediatric neurologist in Omaha. We lived the life of a family with epilepsy. We didn't fully understand what was going on. We were confused, but we accepted it. We learned what we needed to do. We learned when we needed to take her to the ER, when we needed to just watch her at home, treat the seizure, and then watch for life to go back to our normal routine. We were told not to leave her in the bathtub unattended, and I thought, okay, what mom does that? You don't leave your child in the bathtub unattended. That's common sense, whether she had epilepsy or not. And we were told that we only would need to call 911 if her lips turned blue and she stopped breathing. We only had to do that once. She was about 2.5, playing in the floor in the middle of the room. Her lips turned blue. She kind of just rolled over on her side, and then 10 minutes later, she was okay again. There was no big incident, so I breathed another sigh of relief, and we kept going. We had to trust the doctors and just do what we were told. We thought we were getting the best information. We were young parents and trying to figure it out, just like most young parents are doing. And it was 1999. Dr. Google wasn't in practice yet. There were several periods in Amanda's life, when her seizures were very well controlled. She never had seizures frequently They were always spread out. We would have 1 or 2 seizures, and then we would go several months without having seizures. I remember when I was teaching elementary school one day, the teacher across the hall from me got a new student in, and it was a special needs early childhood classroom, and she was talking to me and telling me that this parent was had told her how she had hundreds of seizures, every day. Normal day was 75 to 150 seizures a day, and I just couldn't imagine that. I, of course, was trying to picture my child who had tonic-clonic grand mal seizures and thinking, how could you even survive or get through that? But that was the first that I started hearing about. There were different types of seizures that you could have, and that not all seizures looked the same. So that's when I started learning that information. But I often thought how lucky we were that it was, she had a seizure every once in a while, but she lived a pretty normal life most of the time. I even remember when we would sit at neurology appointments and I would see other patients and other parents sitting in that waiting room with children who were far more disabled than my daughter was, and thinking, we're just fortunate, we're dealing with this, we're living with this. It could be so much worse. And at times I would feel guilty sitting there with a parent, next to a parent whose child was unable to talk or unable to walk, and I was sitting here with Amanda, and she was being as ornery as she could and not behaving in the doctor's office or giggling, which was usually, most of the time, she was very giggly. Amanda participated in many activities, just like every other kid. When she was 4, she took dance classes. When she was 5, the ballet teacher came out one day and said, "I don't think this is for Amanda," and decided that she probably shouldn't continue ballet classes. It was a pretty formal ballet school at that time that she was at. That wasn't her style. A few years later, she took up tumbling and loved doing that. And she also competed in cheerleading one year, for a couple of years actually. At that time when she was doing that, she was in 3rd grade and 4th grade, and that was probably one of the peak moments in her life. She was doing very well, socially, academically, she still struggled, but she was functioning in school. She was enjoying her life. She loved being able to go to cheerleading. She loved going to tumbling classes, and was just, having a great time. She also loved to go fishing and camping, and especially with her grandpa, she liked to go and try to catch fish at his lake house. She played softball, and when she was in 5th grade, she also got to participate in her school play as one of the orphans in Annie. The last couple years of Amanda's life, she took up bowling. And this, if you follow our foundation or hear anything about it, is one of our biggest fundraisers that we do as a foundation. This is how we got started, was with a bowling event, because that was what she loved to do. She absolutely enjoyed every minute of it. She could be part of a team and have fun and be silly with girls, but it was also something that she could do that she didn't have the pressure of other activities or sports. Where as cheerleading, she was critical to everyone else's performance. This was just her performance, and so she felt more comfortable there. Like I said, she did struggle with learning disabilities, and as she got older, we noticed delays in her social skills. Amanda is always remembered for... We'll leave it there. Amanda is always remembered for her big brown eyes and her beautiful smile. And she had a laugh that was contagious. But as she was going through middle school, her seizures were getting more frequent, though still not daily or weekly. And we were having a harder time keeping them under control with medications. We explored the idea of surgery when she was in 4th or 5th grade, and found out at that time she was starting to have multiple types of seizures, so she was not a candidate for surgery. Then around that time, shortly later, my husband retired from the Air Force, and we moved from Georgia to Kansas City and started with new doctors. So many of you know, you start the whole process over again. We talked at times with the doctor in Kansas City. There had been discussion of maybe we should look into VNS. And the last time I spoke with him on the phone, she had an appointment coming up in a few weeks, and we were going to talk about the ketogenic diet. Her last seizure, September 20th, 2011, is a day that frequently on replay in my mind. It was a Tuesday morning, and we were at home. My husband worked odd schedule at that time, so he was home. His weekend was Tuesday. We had all been fighting a stomach bug, horrible stomach bug that weekend before, and Hillary had stayed home from school trying to just get over it and feel better, and Abby had returned to school that day. She was the first one to get it and spread it to the rest of us, so she was feeling better. The night before, when Amanda went to bed, Mark and I were sitting downstairs, and around 11 or 11:30, we heard her upstairs and thought something was wrong. So we went up, and she had had a seizure. She woke up. She talked to us for a few minutes. She was extremely tired, and we felt like she was okay, so we let her go back to sleep and checked on her a few more times through the night, and she was okay. The next morning, she woke up, came downstairs around 8 or 8:30, sat down in the living room and watched TV with me. She laid on the couch across from me, and we talked a little bit, but she was having a hard time staying awake, and she was still just really tired. So she laid there. I told her it was fine, take a nap, and just hang out. So she did, and a little while later, around 9:45, she started having a seizure in her sleep. I hollered for Mark, and he came in, and we could just tell something was different with that seizure. A minute or two into it, she stopped breathing, and we knew there was a problem. Hillary kind of heard us hollering and came downstairs to see what was going on, and Hillary actually called 911 to get them there that day. And Mark went ahead and got CPR started as she lost, she was no longer breathing, and then we lost her heartbeat. I was really, really surprised. I remember and still frequently think about that morning, how quickly the ambulance got there. There's so many times you think in an emergency like that, everything goes into slow motion and it seems like it's lasting forever. And I remember thinking, wow, they got here fast. And there was just tons of people coming in our house. And I, very grateful for that. They took over CPR, but it was probably 20 to 25 minutes before they were able to get her breathing on her own again and resuscitated. Once they did that, they got her into the ambulance and told Mark and I to meet them there. They took her to the closest hospital, and from there, when we arrived there and they let us come back, she had gone into status epilepticus. I always get that one, had to think about it there. She went into status epilepticus. She was constantly seizing. So they started medications, and then they made arrangements, and they transferred her to Children's Mercy Hospital in Kansas City that morning. Once we got up there, they were able to give her medication. They stopped the seizures, but she had already experienced brain swelling, and they had her on cold pads in the bed trying to cool her and see if they could reduce that swelling. After 2 days, there was nothing more we could do, and we had to make that choice and have her taken off of life support, and we lost her on Thursday night. Um, it was an unbelievable moment and something we didn't ever think we would be living through. When we lost her that night, that 2 days is kind of a whirlwind and a blur of just being in the hospital and going through that and everything that was involved in hearing that. But there was just nothing more we could do. And that was the one thing about her death, is that I knew I had peace knowing that we had done everything we could do. We had seen the seizure happen. We had responded. We had got 911 there and had received all the medical care we could. And it was just, there was nothing more that could have been done in that moment. When a person has 2 or more unprovoked seizures, they have epilepsy. And I say that because I've often come across people that will say they have a seizure disorder, or I have seizures but I don't have epilepsy. Sometimes that is possible, but oftentimes if you have 2 or more seizures and there's not a cause for them, that is epilepsy. It is an ancient brain disorder, and throughout time, people with epilepsy have been subject to ridicule and discrimination. Up until the 1950s, there were laws in some states that banned people from getting married if they had epilepsy. And there were even laws that required people to go through sterilization if they had seizures. Thankfully, there's been a lot of research since then, and a lot of awareness and learning, and those laws have been changed. But the general public still does not have a good understanding about epilepsy or seizure first aid. In 2017, the Centers for Disease Control and Prevention reported that the number of Americans with epilepsy is higher than ever. It is estimated that there are 200,000 new cases of epilepsy every year, and 3.4 million Americans have epilepsy. Epilepsy affects more people than multiple sclerosis, cerebral palsy, muscular dystrophy, and Parkinson's disease combined all together. You hear of those diseases frequently. People don't talk about epilepsy. In 2/3 of patients with epilepsy, the cause is unknown. And in 30 to 40% of people with epilepsy, their seizures are uncontrolled despite medications or available treatment therapies. SUDEP. Wikipedia defines it as a fatal complication of epilepsy. It is sudden and unexpected. It is non-traumatic and a non-drowning death of someone with epilepsy. When there's no other medical cause of death evident during an autopsy, that is what defines SUDEP. The North American SUDEP Registry goes further to say SUDEP is a category of death, not an actual cause in people with epilepsy. Not an actual cause in which there's no other cause of death. In October of 2014, Current Neurology and Neuroscience report described even further categories of SUDEP. According to this report, that one, okay. Well, you won't be able to see that one, but the 4 categories they defined are definite SUDEP, where there is an autopsy performed and there is no further explanation for the death in someone with epilepsy. Lost my place. Probable SUDEP is when there's not an autopsy performed, but everything surrounding the incident gives indication of SUDEP. Possible SUDEP is when, Possible SUDEP is described when there are competing causes of epilepsy. So if there's another health issue going on and the person with epilepsy as well, and so they may have suddenly died and thought everything else was under control, but there is possible other explanation that played into that. And then sometimes they use the term near SUDEP, and that is when the incident happens and the person is expected that they would have died from the seizure had extreme measures not been in place. I don't know whether Amanda's case would be considered near SUDEP because they were able to resuscitate her for a while. She just wasn't able to live without life support, or whether it would be considered probable. But the one thing you may have picked up on when I was talking is that it involves an autopsy. At the time of Amanda's death, we chose not to have an autopsy. We just felt like we had seen the incident happen in front of us. We knew exactly what had caused her death, what had happened, and all the details of it, and we didn't feel like we needed to have the process of an autopsy done. I didn't know at that time that they would not diagnose or count her death as SUDEP because there was not an autopsy, but that is one of the things that is required, is that there be an autopsy to define that. They say SUDEP is rare. I sometimes question that. Statistically, up to 50,000 Americans die each year from seizure and seizure-related causes, including SUDEP. The most commonly accepted statistic is that 1 in 1,000 people with epilepsy die from SUDEP each year. However, if you take all of those people who have epilepsy and you look at the ones that have seizures that are not controlled well or poorly controlled, that statistic raises to 1 in 150. And I think that is shocking that it's that high. Certain criteria must be present in order for SUDEP to be diagnosed. It is likely that SUDEP is underreported and often unrecognized by physicians and medical examiners at the time of death. The guidelines were revised, defining SUDEP in 2017 to start getting more awareness, more education regarding this issue, and being able to diagnose it a little bit more accurately. The requirements for SUDEP are that, the person has epilepsy, defined as recurring and unprovoked seizures. The person died unexpectedly while in a reasonable state of health. Death occurred suddenly and during normal activity, including sleeping, which is a frequent thing I've heard with people who are associated with SUDEP. I often hear it happened in their sleep. There must be an obvious medical cause of when an obvious medical cause of death cannot be determined, and death was not the direct cause of status epilepticus, which probably also is why our doctor didn't want to say it was SUDEP. In my opinion, it's obvious that these statistics are underestimated because of the mere fact that SUDEP is only listed as a cause of death after an autopsy, if an autopsy is performed. SUDEP was not listed as the cause of death, like I said in Amanda's case, but the day that we lost her, my husband did sit down with the doctor. Mark was very angry. I didn't sit in on that conversation at the time. But he did sit down with him and say, why? Why didn't this happen? That day was the first day I ever heard the word SUDEP. That's when Mark came out of that meeting with the doctor, and he said that the doctor mentioned it could be SUDEP. He didn't say it definitely was, and I don't think they had a long conversation about that. But that was the first time anyone ever mentioned that SUDEP was even an existing thing to be concerned about. At the time, when she was young and she was diagnosed and they gave me that information and said, watch for her lips to turn blue, I understood that that meant if her lips could turn blue, if she could stop breathing, then, she could die from that. But that was never explained to me. That was never, it was just implied at that one time. That conversation never happened at any other times. And like I said, SUDEP was definitely never discussed. So as I say, SUDEP is underused on death certificates. So the statistics are hard to understand or know exactly how much they are. If SUDEP was diagnosed more accurately, the statistics might be much higher for how many cases of SUDEP there are each year. I will go ahead and mention, too, there are only 2 states in our country that require medical examiners to report SUDEP, and that is in Chicago and New York, and largely because of the work that the Danny Did Foundation did to pass a law requiring SUDEP be reported and accepted as an actual cause of death. So who is at risk of SUDEP? Oh, back on. Again, like I said, underused. Most doctors will prefer to use the terms epilepsy-related or seizure disorder on a death certificate. So the risk factors associated with SUDEP. Anyone with epilepsy can die from SUDEP. That's frightening. But it's also important to be aware and understand the risks. Some people are at higher risks than others. So understanding what your epilepsy is like and knowing what your seizures, how your seizures respond and do is very important. Having that conversation with your doctor is very important to understanding what those risks are. So those that are at a higher risk, that seems really slow now that I'm standing in front of so many people. Uncontrolled or poorly controlled seizures. Getting seizure control is one of the biggest factors that you can do to get to reduce your risk of SUDEP. Having epilepsy over a long period of time increases your risk. So if you've had epilepsy since you were a child and you're an adult, it just is one of the higher risk factors. Being on multiple anticonvulsant drugs to control your epilepsy increases your risk. People who suffer from tonic-clonic seizures are at an increased risk for SUDEP. People who suffer from just absent seizures, and I don't mean just absent seizures, I apologize, but people who suffer from absent seizures are at a lower risk. But you also need to be aware that those types of seizures can change at any time and stay in connection with your doctor about that and if that risk increases. People who have epilepsy and also have developmental delays are also at a higher risk. And again, people who have seizures while they are sleeping are at a higher risk of SUDEP. And this one's in bold because it's important. People who do not take their prescribed medications correctly or stop them abruptly are at a higher risk of SUDEP. It is very, very important whether you're 2 years old and your mom and dad are responsible for getting you that medication, or whether you're 18 years old and just starting out on your own, to take your medication correctly. It is so important. One missed dose can lead to having a seizure, and you don't know what could happen. Reducing the risks of SUDEP. Avoid seizure triggers, knowing what things trigger your seizures and trying to stay away from those. If it's flashing lights or spinning rides or whatever it may be smart about what your seizure limits are. Use precautions when participating in activities that could result in an accident. If your doctor says you shouldn't drive, then you're increasing your risk for a seizure-related death. Again, taking your medications as prescribed. Forming an action plan. Some of you may be familiar with these. I was not. We moved to Missouri about 6 months before Amanda died. And when we moved her, she was in 7th grade. And I remember, we were moving across the country. Dad had already been gone for several weeks, and I'd been doing mom by myself for 3 girls and was really ready to get in place and have things set up. And then we got there, and and I'd been talking with the school several times before the move happened. And I remember them telling me, well, we're going to wait and have her start a few days later than the other girls because they needed to have an action plan. And I was like, a what? And I'm going, she's 12 years old. We've never had an action plan. That was the first time I'd heard about that. But there are tons of resources available online. If you just Google Epilepsy Action Plan, there are lots of resources, templates that are out there that you can set up and have information to give your teacher at school to have in place, to give caregivers, give your coworkers if you're an adult with epilepsy, so they know what to do and how to respond if you have a seizure. Hold on. Explore all options for controlling seizures or reducing the number of seizures that you have, whether that's checking into having brain surgery or VNS implants or changing your diet, natural remedies. There are lots of options out there. And if something isn't working for you, don't just say, well, it didn't work. Keep trying. There are plenty of devices that are available that can help monitor when you have a seizure and alert someone to be there to help you if you need it, or let someone know where you're at. Those devices, may be things that just work in your home that alarm you if your child has a seizure in their sleep, in their bed. It may be a wearable device that if you're out on your own and experience a seizure, then it alerts someone where you're at and lets them know. And also including service dogs that can alert and let you know when someone has a seizure. And also, if you are a caregiver, being trained in CPR and knowing how to do that is vital to the care for your loved one. Last thing I want to tell you of how to reduce those risks is just to be informed. Get all the information you can. I know it's a scary topic and nobody wants to sit and talk about a possible death because of epilepsy. I don't want you to leave here scared about it. I don't want anyone to live their life in a way that they are in constant fear of, could I die? Could my child die? Could my sister die? But you need to be informed. And the more you know about that, the better you're going to be prepared and able to avoid some of those things that can help reduce that risk. The most frequent thing I heard when Amanda died was, I didn't know you could die from epilepsy. I had people call me, family members that we were close to. I didn't know that this could happen. I had phone calls. I remember they did an article in the newspaper about Amanda, and it included contact information for me. And I remember getting phone calls from perfect strangers who were adults living with epilepsy that said, I never knew that that could happen, and I've had epilepsy all my life. I often tell people that I knew it was a possibility that she could die. I didn't know the specifics. It was implied when she was young that there was always that risk that something could happen, or she could fall and hit her head. I knew that was that possibility. I also thought it wasn't likely. I remember Hillary was probably about 14 years old, and Amanda was going through a really hard time of having seizures frequently, and they were getting worse, and we were having a harder time controlling them. And I remember one night Hillary came to me way too seriously and just a very quiet, small voice, and she's like, could Amanda die from this? And that was the first time she'd asked me, and that was the first time I'd had to say it out loud. And I was honest with her, and I told her she could, but it wasn't likely. I always thought of it like when you go in to have your appendix taken out or some other kind of small routine surgery, and they tell you all the risks and that this could happen. But I never thought, it's not likely. It's not going to happen to us. Didn't think it was something we needed to be concerned about. I don't regret living our life in that way at all. I'm so glad I didn't live with that fear and hanging over my head. But I do wish I had known a little bit more about the possibility and had that conversation with our doctors before it was after the fact. Every person with epilepsy should be warned about the risks of SUDEP. Oh, I went backwards, sorry. Can you just click it back to that one? Every person needs to be warned about that. It should never be a surprise. There's enough going on. If you are faced with the consequence of SUDEP, that it's the last thing you want to hear after the fact. And if you're a doctor or you know a doctor, it is so important to tell patients up front about this risk. There's a lot of times that it's an uncomfortable conversation, so they avoid it. They don't want to overwhelm the parent when they've just been diagnosed. But guess what? Most parents or adults that have just been diagnosed and gone through a seizure are pretty overwhelmed already. So go ahead and tell them all the facts up front. Don't wait. Tell them up front. So again, you can reduce your risks of SUDEP by avoiding seizure triggers. I'm going to click through these a little faster. Taking precautions when participating with activities that you participate in. Taking medications as they're prescribed. Make an action plan. Explore all your options for seizure control. Use seizure monitoring devices. Know seizure first aid and CPR. And be informed. Caregivers, friends, and family should all know how to respond if you have a seizure or if your loved one has a seizure. And I know we are probably going to run, we are running short on time, so. Seizure first aid. And many of you already know these things. Time your seizure. Clear the area around the person to protect them. Roll them to the side, loosen tight clothing, remain calm, and reassure the person that you're there with them and you're getting help or attention as they need, or that they are okay. Remain with that person until the seizure is over. Look for an action plan if the person has one with them, and call 911 if the seizure lasts more than 5 minutes or the person stops breathing. Okay. This summer, epilepsy awareness probably was at one of its peak moments, unfortunately due to the death of Cameron Boyce, a Disney star. I know our foundation, as we were working events over the summer and early fall, had people come to us constantly and say, oh, that's what happened to that kid from Disney. He was 20 years old, and there I was again, listening to the news, hearing of another parent who lost their child. This time they were famous. I didn't have to wonder anymore if I needed to worry about that. I knew the reality. And I share with you Danny Stanton from Danny Did Foundation, and Lily Zwallen, whose parents are here with us today, and sister, who lost their baby girl when she was only 18 months. Chelsea Hutchison from the Chelsea Hutchison Foundation. And I don't have a picture, but Jordan Swearingen. Those are people I personally know in my life and have experienced firsthand the loss with SUDEP. So again, and Amanda, I question how rare is it and what more needs to be done. How many people have to keep dying before there's more research funding? 50,000 deaths annually from epilepsy, 42,260 deaths annually from breast cancer. What breast cancer has done with the pink ribbon and the awareness level is phenomenal. They have improved the survival rate. They have improved research. They've got more funding. And it is phenomenal. Everybody who sees that pink ribbon somewhere knows exactly what it stands for. And that is what I want when you see that purple ribbon. I want it to stand for everyone in this room with epilepsy, every 1 in 26 around us that have epilepsy. When you see the purple ribbon, I want it to mean that there's more research, more funding, and a bigger survival rate. I want to leave you today knowing that even though this was a scary topic and hard to talk about, there's hope. Events like this one. There is a whole sea of purple out here this week, and take advantage of it. Feel the support and the strength and the passion of everyone you are here with this week. And on top of that, you have a wealth of information at your fingertips. This is why our foundation feels so strongly about this event that we sponsor families to come out here every year for it. There's no place you can get more information. If you're wondering about those devices, about a seizure dog, about a diet, walk out there on that floor and you will find the information you're looking for this week. November is Epilepsy Awareness Month, and this is one of my favorite things that our foundation does, is to spread that awareness. Why does it matter? Because one time it didn't matter to me either. I didn't know it was going to matter. Again, I'm with the Purple Peace Foundation, and we do have a booth out on the floor. And I apologize that we're running over, and I don't have a lot of time for questions, but if you would like to stop by and talk to us or catch us out in the hallway, we're more than happy to talk to you. I appreciate your time and attention this afternoon. Thank you.